To a vaccine. Last evening, the expert panel gave nod to Serum Institute of India's Covishield that has been developed in collaboration with Oxford. The SII vaccine is now awaiting a green signal from DCGI, and India is already preparing for a mass vaccination. A nationwide vaccine dry run was conducted today. There's a sense of excitement among Indians over the vaccine, and this excitement comes with a lot of questions. And to answer these questions, we have Dr. Veer Pushpak Gupta. He's frontline doctor, National Health Service, UK, and member of the Royal Society of Medicine in London. He's joining us live this evening from London. And our first question to him as he joins us from London is about the mutant variant of the virus that has surfaced recently. Doctor, you have been working on the front line for the last 8 months, and in fact even more than that. With the rise in the cases related to mutant virus, do you as a doctor see any difference in symptoms or mode of treatment?
Oh, thank you for having me on the show. Look, this mutant virus that has come out from the UK has been a concern for everybody, and I think one of the reasons that it's so concerning is because of the effectiveness of the virus to now latch onto our lung cells. There's been a mutation in the spike protein, which is the protein that is used by the virus to latch onto the ACE receptors in our lungs, and that makes it 70%, up to 70% more transmissible than was previously thought. And what happens is, if you think about if the virus is spreading, the previous strain of the virus spreads from 1 person to 4 to 16 to 32 and so on, this virus will be then 70% more transmissible than the previous strain. And that was the concern. And I think you can see that in the numbers in the United Kingdom. Yesterday, we had about 50,000 cases in the United Kingdom with 650 deaths. And I think that increase in numbers is probably all the fingers are pointing towards this new strain.
So, going ahead, do you see the possibility of more mutated strains of the virus? What could be the impact of this at the global level in terms of handling as well?
Yeah, look, viruses and bacteria mutate. Every scientist that has ever worked in a lab would know this. You know, this is it's survival of the fittest. Every species on Earth practices survival of the fittest, and viruses and bacteria are no different. Different strains, different mutations allow the virus to be either more transmissible or even less transmissible. So there could be a mutation that could actually decrease its transmission, and we saw that previously with certain viruses, that the decrease in transmission actually led to the virus being less effective than previously thought. So I think mutations will be common. The focus has to be on the basics, and the basics of this virus will never change. The fact that it can be transmitted through aerosols, the fact that it can be transmitted through contact, these are the basics of the virus, and we have to be proactive in protection against it. The vaccine helps. The mask wearing, social distancing, hand hygiene, all of these things will need to be done to break the chain of transmission.
No doubt about that, Doctor. Now, moving on to my next question, in fact, the inoculation has already started in the United Kingdom. Any challenges that have been faced there so far? And can India take any lessons from the challenges that UK has faced?
Yeah, UK has been a case study of challenges, I think, since the start of this virus. You know, we had a spike back in March, and then things settled down in the summer, and now we're having another spike. The vaccine program with Pfizer started about a month ago, and it has been so far running quite smoothly. I think as of last week, 1 million doses of the Pfizer vaccine had been given by the NHS to mostly 80 and above, and also care home residents and frontline staff, frontline NHS staff. And so far, there has been no major side effects from the vaccine in the UK population that we know of, apart from minor allergies or people with allergies having some sort of small side effects at the start of the, when the vaccine was given. But other than that, nothing major has come out of that. And I think the vaccine program is going quite well. And now with the start of the Oxford and AstraZeneca vaccine, which is much cheaper to give and also much easier to give in terms of cold storage, I think this is going to be a game changer in terms of vaccination in the United Kingdom and even in India.
Yes, and in fact, UK regulators, talking about the Oxford vaccine that you were talking about, because UK regulators have given a nod, and we're just getting to know that the expert committee that was chairing a meeting a few minutes back. The meeting has also concluded for the second day, and an announcement on the final vaccine is probably going to be taken tomorrow. So considering all that, how do you think this vaccine, the Oxford vaccine, has an edge compared to others?
So there's various reasons. First of all, let's look at the mechanism of the Oxford vaccine. So the Oxford vaccine is an adenovirus vaccine, which means that a part of the virus is actually inserted into the cell, into our cells, and then our body creates an antibody response to that DNA of the virus. And it takes about 4 to 6 weeks until the next dose is given, and that's when you are supposed to have complete immunity. Now, the dosing of this virus has been seen as that the first dose can be given as a half dose, and the second dose can be given as a full dose. So that automatically increases the number of people that you can vaccinate with this virus, with this vaccine. The other thing is that the price of this vaccine is very cheap. It's being given at £2 to £3 per dose by AstraZeneca to the UK government and also to developing countries. And they are the first vaccine that has said that developing countries will not have to pay higher than that in any shape or form. So I think that's very important when we're trying to vaccinate a large number of people. And the final thing is that it can be stored at temperatures between 2 to 8 degrees Celsius, which can be stored in any refrigerator in a frontline practice, either in an urban setting or in a rural setting. And that is very, very handy for people that will be giving vaccines in India, especially in the rural settings where this can be stored so easily. So you don't need the expensive cold chain storage that was needed by the Pfizer vaccine. That is quite expensive and quite hard to set up. So there's quite a few advantages with this particular vaccine, and I think that this will be the vaccine that will be used for mass inoculation around the world, especially in developing nations.
Clearly, that's going to be very important. But Doctor, now India, our health minister this morning has also announced that the inoculation, the vaccination drive for at least 30 million health workers would be free of cost. So considering your experience with the UK, do you think that's going to be feasible? And how do you, in fact, view this entire vaccination process, the strategy that India has placed as far as vaccination is concerned? What is your view as a doctor on it?
See, I think from the numbers so far, India is doing a great job. I mean, you had 17,000 cases in India yesterday, which is 1/3 of that of the United Kingdom. And UK's population is 75 million, and the Indian population is 1.3 billion. So I think that the government of India have done a fairly good job in terms of controlling this virus. In terms of vaccination, I think India has vast experience with vaccination. India did the largest vaccination program in the world when they eradicated polio. And I think that the structure and the basis of the vaccination program will remain the same. In the NHS, for example, in the UK, we do flu vaccinations every year. And we use the same program, the same structure to give out the COVID vaccines. So I think India has vast experience with vaccination programs. I don't think getting the vaccine out to the people will be a problem. But yes, if petty politics can come into way with, ministers saying that, this is a vaccine from one party or the other, then those things can cause problems. I think science should be kept first, and the welfare of the people should be kept first.
Yes.
This vaccine can be backed by science. It has done its fair share of research and been passed by the MHRA in the UK as well as the Indian regulators.
Yes, and as you rightly pointed out, that there cannot be politics, at least in times like this, because we are dealing with a pandemic here. Doctor, my final question to you would be, as someone with a ear to the ground, because you've been working for more than 8 months treating COVID patients, what are the key learnings in the past 8 months that you've picked up?
Yeah, it's a very good question. Look, we started this fight with a virus that was never before seen on Earth. All the frontline workers, all the staff were put into this fight without knowing what they're dealing with. And now, 8 months down the line, we have not only a vaccine that we can use to fight against this virus, but we have also developed treatments along the way that can help to increase the life expectancy of the patient in a hospital. For example, Recovery Trial in the UK came out with a very cheap drug, dexamethasone, which is a steroid drug, that that can be given to patients that are in the ICU or in the hospital that are suffering from extreme bouts of COVID, and it can be given at very cheap price, and it has shown that it is very effective to increase the life expectancy of patients that have COVID inside the hospital. Apart from that, convalescent plasma treatments, remdesivir, which is an antiviral drug, and in India, various other drugs are also being trialed. So I think that we have learned a lot about a disease that we never saw before, and we have actually managed to come out with treatments that can save lives. The entire effort now is the logistics to try and get those treatments to the people that need it the most. And I think that 2021 will be the year that we are going to try and do that and help with an entire logistical supply chain around the world to get these treatments to the people that need it most.
Yes, Dr. Veer Pushpak Gupta, thank you very much for joining us live from London and giving us information on this entire vaccination plan. It was a pleasure having you here, and I'm sure our viewers are taking back a lot of information as far as the vaccine is concerned, as well as the mutant virus. Thank you very much for joining us.
Thank you very much. It was a pleasure to be on your show. Thank you.